Good. Go and look at the twitches going on in his lower back here, Leo. Right. Yeah. Could you see him? There.
Oh. Oh. Oh.
You're right. You're right. I reckon we're unraveling some good stuff here, man.
Oh, we're unraveling some
it's
good
good.
shit.
It's what you need. Let go. Let go. Let
go.
I'm
trying. Oh.
G'day guys, Das and Jace here for another YouTube video. Today we're talking all things hips and how we look at assessment and how we can then treat the hips to better range of motion, range of movement, freedom of freedom, and, all of that, and performance, power. It can be all inhibited by tightness in your hips. So we're going to show you a couple of special tests to begin with to see what's going on with Jace. And this is live. It's like what I would do on any normal client that would come in that's got some, I don't know, imbalances, or asymmetries or pain or discomforts in the hip. Yeah, this is sort of like a fly on the wall experience, how I would really treat someone. So let's start with our Thomas test, Jay. So come to the edge of the bed.
Yeah.
Really got to make sure that his sacrum's not too high. So he's sitting right on the edge, and I might even adjust him, but you just pull. So Jace needs to pull that as tight as you can here, and I am. I'm just gonna grab him there and pull him a fraction further. So I need that sacrum to come off. So what we're looking for here is Jace pulling this right up, and as he pulls this up, we want to see if the hip flexor is tight. We know this by the knee would be higher. So this is negative test that the hip flexor is tight. That's pretty good. And then we can test the quad. See how this is not 90, so we'd want, that would be 90 degrees. It was a little bit tighter, so we think that the lower quad is going to be tight, and then also the tib ant isn't too tight, or the perineals, because it's not really pulled up by this. Come through the central part of this, Leo, as well. We would also see tracking of the hip coming in if the adductors were tight, and we would see it pulling out if the glutes were tight. I would say it's fairly neutral with a little bit of tightness in his glute. So right glute at the moment I'm thinking, and lower quad I'm thinking. Okay, we're going to keep that, and you're going to grab the other one, and then let this one fall down without him falling off. This one's a little bit better. Yeah, this one's a little bit better, but again, the quad, see how this is at 90, so that would be 90, that's where we want to see it.
That one feels tighter.
That one feels tighter. It's actually funny. We did some filming previous to this, and we treated his right quad. So we're already going to know that doing a little bit of treatment through his quad, we're going to see some improvement in his quad range. His hip flexor is a little bit tight, and I'd say again, that's pretty neutral. That's pretty neutral from his ASIS to his knee. I'm pretty happy with that. Let's go flat up on your back. So mostly quads, if anything. But let's have a little bit of a feel around what's going on as well. So I grab his leg. This is me actively. So we're going to start with, we'll start with an active straight leg raise for your hammy. Fantastic. Looking for 90 degrees. He's about 85. I don't mind that.
It's not too bad.
Yeah. And then we can do it passively as well.
About the same.
Pretty similar, which is good. Let's try this guy. It's almost better, but it's pretty similar again. Jason's mobility's not bad today.
Oh, how's that?
Really good. So 90 degrees is only 5 degrees off. Really good. So hamstrings aren't too bad. What I'd have a look at is hip flexors and also glutes. So
what are you feeling for when you're coming up there, Dars?
So a nice end range, a nice bouncy end range. It doesn't feel blocked or clogged or really stuck. And that's pretty nice.
Pretty good to me.
Yep.
Also, if I feel any pinching as well.
Yeah, it's exactly. I'm sort of discussing with Jace how that feels. Internal rotation's a little sticky, but not too bad. And that's definitely not very good. So we're looking for about 35 and 40 degrees. Internal, we want 35. External, we want 40. He's almost got more in internal than external. So those glutes that we had a look at earlier, we get a better idea. And on this side as well. Let's have a little bit of a go. Oh, that one's a little bit blocked. So that first bind, I can feel that either it's, what do you feel? Top of the hip or hip flexor? Probably more top of the hip,
I reckon. I don't really feel too much in the hip flexor.
Yep. So
maybe even TFL might be.
Yeah, TFL. So that little guy that loves to compensate on the outside. And that one's a bit clunky, isn't it?
Yeah. Better external though.
Better external. Better externals. Okay. Internal, cool. And what I also like to do is just groin. So coming out here. Nice. Holding that hip there so he's not faking.
Feels all right.
Don't get a false test. That's good, man. This is the best your hips have moved in a while, Jace. Did some mobility this morning.
Yeah, that's it.
A little tighter on this side as well.
Kicking leg. Could be wide.
Yeah, good. And we can also just do short. Not too bad, Jace. I like the way your groins move.
Yeah.
Really good, really good. Let's just feel some hamstring strength while we're here. So pull down on my hand. Yeah, strong as an ox. And again, good, strong as an ox. And last of all, hip flexor strength. So straighten that out and push up against my hand. Nice, really good. Just looking for you to be able to hold that position there. Hold, push up. Yeah, really good. A lot of people do struggle with that. All right, we need to retest. So we need to discuss what we're going to treat. Left glute, left piriformis external rotators, left quad, right hip, sort of like that psoas or TFL, and maybe a little bit of pectineus in there. Okay, so we've got a little bit of an understanding of where we need to go to free up Jason's hips to, I guess, better his performance and get the most out of himself. Lost my wax, Jace.
Oh no!
Lost me wax. 1 second.
I'll strip off for you.
You'll
and get
strip
ready.
off for me, man. Thank you.
1 minute, guys.
Oh, you've got that. Beautiful. So this is somebody that comes in with no real complaints, just a little bit of general hip tightness. They've got footy tomorrow, which Jason does, and he wants to get the best out of his game and his movement and range and everything like that. All right, so we're going to start with left lower quad.
Oh, this one might be pretty nasty, I reckon.
Lower quad and even that junction point.
Yeah, I reckon that.
Off camera is where we found
Lateral line.
Lateral line.
Yeah.
So I collect, so sink in using my pisiform, really collect that outside. We're going to go vastus lateralis to begin with, that lateral quad, one of the 4. Sink in, and then we're just going to work our way up to the ASIS. So in a direction that we're on an angle of 45 degrees, ASIS being right up here.
Yeah.
There we go. So just sinking in, nothing super deep. We do have a lot of fascia that sort of crosses over and intersects between these muscle groups here as well in this quad. So
you that lateral line and that ITB sort of, there's a lot of fascial connection there.
There is. So sometimes we just need a bit of hydration in there. So going really slow and feeling for the adhesions like that one there.
Oh, that feels sticky. Oh. This is going to be a fun session, guys.
Yeah.
Stay tuned.
Yeah.
There could be plenty of moans and groans in this one.
Well, that's it, because when we're looking to be effective with our treatment, we want to find out where the tension is. Where is this person holding the most build up and where they have the most blockages? So we aren't guessing. We're not just throwing mud at a wall and hoping something sticks. We're actually going through a thorough assessment, and that's what you'll get when you come into MMT is individualized, personalized treatment tailored for you, right? It's not just, we'll just
standard treatment.
Stock standard treatment. We'll just treat everywhere and then you'll feel better. It's all right. Let's get in. I mean, unless you do have pain and injury, and that's pretty obvious, then we can guide our treatment by that. But also, you can just come in to better your performance to get the most out of yourself. Which Jason's going to love this tomorrow.
Oh, I'm going to feel so good.
He said he's going to have 40 and kick 4.
Let's hope so.
Get bog.
Oh, geez, that whole quad's tight, isn't it?
Yeah. Really good. All the way up. All the way up.
Geez, that knee's just going to flop down after this.
Yeah. Did you know where you're going to be tight? Like, you've always had external rotation problems on this side.
Yeah,
Any
I always know my
surprises?
glutes. Quads are all, like, whenever we do quad testing, like if it's like just knee flexion, generally my quad range is quite bad. But I don't necessarily feel tight in the quads. Like when I'm playing footy, or they're never something that I go, oh, my quads are tight. But I just know when I get treatment, they're super tight. And they probably obviously restrict a lot of other movements. And obviously if the quads are freer, then I'll be able to get more range and better performance. So
I guess AFL kicking is a lot of knee flexion, 40 kicks before training, 150 kicks at training, 150 kicks at Thursday night training, and then another, 20.
10 on the weekend.
in the warm-up, another 50, and then on the game,
3.
maybe 30. So what are we up to? About,
Couple hundred kicks.
600 kicks a week on the left foot. It's quite a lot. A lot of that repetitive action, so no wonder his left quad is tight, feeling sticky.
Oh, yeah.
and restricting that knee flexion. Really good, man.
Yeah, that one felt better, that line. Yeah.
So we're going to go a little bit more lateral, but I'm just going to come up nice and high because I do like to get into that tendon. So right up onto the ASIS where it attaches. So the ASIS is that bony landmark on the front right
of your hips,
here. So right in where that insertion point of our quad originates. So we effect up there as well. So we can just sort of probably come back at it with an elbow there.
Yeah, I reckon that outside line there. Yeah, that.
Yeah.
Oh, yeah.
Yeah. I'll be doing absolutely nothing medially, so let's be effective and work it there. Close to his TFL as well. Nice. Pin that. This will also help hip flexion and what we tested earlier on as well.
Yeah, if you're getting that pinching in the front of the hip there, a lot of the time it can be those quad attachments.
Yeah. Good. Sink out of that for the sake of the video. And now I'm going to show you a really nasty junction point. Let's see if Jace can handle it.
Oh, wow. Thanks,
So
Daz.
lateral quad, I really like this spot because it just is bang for your buck.
Not going to need much.
No, that's about as much pressure. No. It's one of those.
It's all right. It's all right. You'll probably go a little bit more. Yeah. I'll let you sink in. Oh, oh, shake it. You feel the twitches?
There we are. So probably about 50%.
Oh, he's a strong boy though. Oh, 50% of a lot of strength.
We're going to 60%.
You feel that down in my knee?
Yeah, well there we go. So yeah, sometimes our ITB becomes a little bit sticky to our lateral quad. So that's where we're gonna, that's that word sticky that I keep using. We're trying to like unravel the adhesions and the build up and just sink on that and just wait with weight until this sort of muscle disperses and lets go and we melt that tissue.
Yeah. You think as fascia is like gelatinous type tissue, if it gets hardened and dehydrated, it gets stuck and doesn't have that elasticity, where if it's nice and stretchy, it's almost like blue tack. If you keep moving it and playing with it, it stretches and it gets warm and it's hydrated and you can move it really easily, where if you first get blue tack and it's stuck together in a ball, you try and stretch it, it's really hard. It's like these tissues in here, you just got to hydrate them, get that warmth, get that blood flow, and then they'll have that better elasticity and that stretch. Oh boy!
Great analogy, Jace. I like that.
Oh, I don't know where the blue tack came from, but hopefully it's called blue tack everywhere around the world.
Yeah, that or Play-Doh.
Oh, Play-Doh. Oh.
Really good. How's that feeling?
Yeah, gold.
I also like to just have a little bit of a shake of the hip and that sort of helps it as well. All right, we're going to go over to the opposite hip now and have a little bit of a shift everything over. I'll drape you, Jason.
Thanks,
I'll get you up like this. Okay, so we're going to go that sort of hip crease spot there. See what's going on. Is it a bit of pectineus? Maybe there.
Not too bad. It's a little nervy.
I don't mind the little nervy spots as long as it's not super hot and sharp.
A little bit hot.
A little bit hot.
That one's tingling in the knee.
So just using my thumb, sinking in, sticking to our philosophies and going close to that bone. So if we were picturing the front of the pelvis there, we'll be pinning into that attachment site there of pectineus, probably getting a little bit of quad as well, and also the insertion of our hip flexor, which would be more like right up and in. It'd be pretty hard to really get into that, but we're affecting a nice little money spot of tendons where they all sort of lie. Not too bad. You get the elbow. Let's see if we want to go a bit more lateral or more medial. How does that feel?
Not too bad. Yeah, that's all right.
Might go a little bit more on the quad.
Yeah, again, not too
bad.
Yeah.
Good. So yeah, we don't want to waste energy or time on spots that aren't, don't resonate with our client. So we're always asking for feedback. It's a good way to communicate and talk about what's going on for our client on the table. There's a little bit more.
Little bit there.
tomorrow's game day, so we're not going to really smash him. But even just holding a spot for a substantial amount of time can leave it bruised and sore, so we're not going to do that either, you know, just a few moments in there. Oh, there's a little bit more of a kink there, I feel.
Not too bad.
Not horrible.
Not horrible.
And we're always trying to find it. Where is the spot? Where's the block? Where's needs to be cleaned and cleared and moved along? Okay, not too bad. Let's get you lying on your side, face me, and we'll do a little bit of that TFL, man.
Yeah.
So this is TFL, one of those little muscles that always acts up. And we just about there. You can see right.
Just in the pocket.
Right in the pocket.
Oh. There we go. Hold that out of the way for you.
There we go. Ooh. Nice one. So again, one of these muscles that starts in the top of the hip, but it then turns into our IT band. So that really thick connective tissue like substance. It starts as normal muscle tissue, and it's our TFL, tensor fascial latte, internal rotator, hip flexor, assists in adduction. It gets pretty angry.
Oh yeah.
It's a lot smaller than the rest of the muscle groups around this area, but its responsibility and what it's meant to do for the body is quite high. So it does compensate all the time and really we find trigger points in there.
Yeah.
Double thumb, but how are you seeing that, Leo? Pretty good?
Yeah, it's good.
Oh. Oh. It's just one you've got to grit and bear for a little bit, but I feel like TFL is the one that like you almost instantly feel better.
Relief.
Like
Instantly.
as soon as you lift your thumbs out of there, it's just like, oh.
Yeah,
So like
straight
different.
away.
Like, you don't have any, I don't really ever have residual soreness, like
Yeah.
quad and hamstring sort of stuff. You feel a bit sore the next day still.
Yeah.
But this just feels, so much freer.
Yeah. Yeah, if you've got a partner or you need this or you have hip tightness or hip impingement or anything like that, try this on your partner. Get them side lying, feel on their shorts or their jeans where their pocket is, and it's only a small little guy right in the corner, and just pin and hold it. And it's sensitive.
Yeah,
Go towards the pain and work it. The thumbs, it'll test your thumb
Endurance.
conditioning and endurance out, won't it? Because it is tough, it is a hard one. Make sure you bend the knee, bring that knee right up so it softens it. If he's got a straight leg, it is harder to get into, more solid. So that's really starting to melt under my thumb, which is a really good sign that we're getting that blood flow and that muscle release is starting to happen. So I'll sink out of that. Really, it's just a nice way to feel it sink out. You can see my thumb mark exactly where we are. All right, Jace, that's good. Let's go flat on your back. And
Flat on back?
Yep. I just want to retest that hip and you tell me how it feels. Yeah. So that end range, earlier I felt it about 90.
Degrees, yeah.
Now it's higher,
Softer.
softer, and internal
That feels
rotation's cleaner. Yeah, much cleaner.
Yeah.
So just a couple of minutes in that hip. Really good. What I don't mind doing is a little bit of a stretch, so I can sort of hold him there and then get Jace to pull his hip in. Yeah, that's it. Good, and rest. Just a bit of a PNF stretch. Yeah. And again, pull in. Nice, and rest. One more. So just find that third bind all the way further and go. Nice, so we're there, we're pulling him into external rotation rather than the internal rotation. Cool. All right, man, feeling good.
Yeah.
Let's get you on your stomach. Things are happening.
Things are happening.
Getting better.
Oh, feeling good.
So,
Until I get my glutes treated.
left glute, wasn't it, to finish?
Left glute, yeah.
Left glute. So, Let me just drape him properly. Put this under your feet. Thanks, man.
Thank you. Oh, this is always the fun stuff.
Okay, so let's start on the sacrum. And so getting that pisiform on there, and you can see how bouncy that joint is or should be. And we're just going to get a little bit of a joint mob going on in there. So just getting some mobility through that SI joint, sacroiliac joint, and then we're going to trace the ilium out towards the lateral hip. Just staying connected. If I get my knees up here, I can get a better angle on it. Not a lot of wax, but just enough to glide and slide down that hip. Now this is a challenging one. We have done a video on this in the past, maybe two, trying to improve Jason's stubborn external hip rotators. So
it's been limited for a fair while, hasn't it? It's probably something I need to work on. It always used to be internal rotation used to be an issue, but I feel like that's been pretty good recently.
Yeah. Yeah. Our pelvis is it's a tricky joint. Sometimes our pelvis is internally rotated or externally rotated. You know, it's not sitting perfectly symmetrical, which is hard to see by the blind eye. You'd have to see it more so on an X-ray. But I would say that Jason's left hip would more likely be already in a little bit of external rotation, meaning when his pelvis, meaning when we try to move his femur on his pelvis, because it's just like any other joint, that pelvis is already in external rotation, limiting more external rotation. Okay, so just something to think about there and to consider. So we can combat that by trying to pull his pelvis into more internal rotation, you know, try and balance that imbalance out. If we didn't have a lot of change or a win with treating the tissues. Okay, so going to pin that now. So working again on the edge of that sacrum, and then just going to go really deep, sink into those tendons, and then work it all the way down and out. Sometimes we'd even work into the lower back, just to get, again, that pelvis, that sacrum to...
Oh, here we go. Oh, it's starting to hit the danger spot.
Yeah.
Oh.
So through those layers of glutes, we then find a piriformis and those external rotators. Piriformis is the more well-known one, but there are 8 other external rotators in there. And internal rotators, quite small muscles. But we do need to get through that first layer, our glute max.
Oh, there it is. Yeah.
There it is. And get some twitching there.
Oh. Trying to relax it for you.
Good, Jace. Yeah, don't fight me. Relax into it. You're going to get the most out of the treatment.
Oh, that glute, meat and min always feel nasty.
Doing well, man. Doing well. Got to fix it today. It's been stubborn. We've had a few goes at it in the past.
Oh.
Sorry, Leo. I'm just going to lean over.
Oh. Yes. Oh. Oh.
I'm not letting up.
Oh, you're not letting up. I'll let up then.
Yeah.
I'm not going to win that battle.
Who would win in a battle out of Jason's ass?
My glute and your elbow?
Yeah.
I reckon your elbow's got me covered on that one.
Sinking in.
Oh, no, that's going to take a bit.
All right.
No, I'm all good.
It. Yep,
got to get in the zone.
Gives it a wiggle. There we go. Nice, man. So sink in. He's staying pretty relaxed there. I'm targeting those external rotators now. So I'm angling in. So I'm going under the glute max and pinning in to that ischial tuberosity, sort of that area where our hamstrings attach onto. But in between our SI joint, so our sacrum, and our greater trochanter, which is the bony landmark on the outside of the hip, is where you're going to find these external rotators. So I'm coming off the greater trochanter, that lateral hip bone, and then pushing in. We're going to grab his hip for a more dynamic release. So we're pulling him
Oh.
External this way. Internal this way. Don't get confused with the foot.
Yeah.
You look at the hip. So that's an internal, and that's bringing up the muscle there. External. We're looking at the knee. Nice, man.
Oh, well.
Good. Go and look at the twitches going on in his lower back here, Leo. Right. Could you see him? There.
Oh.
There.
Oh. Fuck.
You're right. You're right. I reckon we're unraveling some good stuff here, man.
Oh, we're unraveling
It's
some good
good.
shit.
It's what you need. Let go. Let go. Let go.
I'm trying.
Good.
Oh.
Nice. Couple more.
Oh, that just feels sticky that way still, doesn't it?
Yeah. It's brutal.
Oh. Oh.
It's brutal.
Oh. Fuck.
Before I wrap it up, because we were limited on that internal rotation on the other side, and we were pretty clean, but just a tiny bit there, I reckon we look at the agonist and the antagonist, meaning what is the muscle that is supporting and stabilizing the other muscle through a joint. So meaning, you know, when we're doing a bicep curl, our tricep is supporting our bicep. Yeah, so, and vice versa when we do a tricep dip or extension, our bicep. So our glute is the antagonist to our hip internal rotator, our TFL. So I'm gonna come in here because sometimes, you know, you can't fully flex your elbow because of the tightness in your tricep. Yeah, so we're going to see if we can improve his internal rotation by treating his external rotators.
Oh.
And because Jace just has such a good time treating his bum, he loves it. So we'll just keep going.
Yeah.
Get in there.
Treat the glutes for days.
Treat Jason's glutes. It's his favourite.
Do you reckon
thing
these
to
are the most treated glutes on YouTube?
Easy. There's over 1,000 published videos and 690 of them.
My glute, you reckon? I reckon we could do a count and maybe that could be a poll we can run.
Yeah, can somebody go and have a look? Count them up.
How many glutes?
And if we've treated the left and the right side, it means is that 2 glutes or just 1 glute? You know? Does this count as 2?
No, this is 1 glute video.
1 glute video. Okay, good. Just to get clarification for those that are going to go and do that. We hope we've got you to what time have we got on there, Leo?
27.
At the 27-minute mark, we'll test you guys. Comment below. How many do you think? Really?
How many glute videos have I been in?
Yeah.
Oh, as the glute model or the treater as well?
Just the model.
Just the
Or
model.
maybe both.
Nah, just the model.
Just the model.
Most treated.
Good. And this hip is really starting to lubricate. So we're getting some of that synovial fluid into that joint. And you can feel that is just free as
that's
anything.
floppy.
That is floppy. Look at that. Yeah. Feels good, huh?
Yeah.
All right, Jace, let's test our Thomas test. Finish up, see how that quad is on the left. If you can, man.
Hold me, Mike.